When making large capital investments, you need to feel confident in the long-term reliability of your equipment and that it meets your return on investment and value criteria, whether this be financial, operational, clinical or patient care orientated. You deserve a reliable partner who is focused on your success through system availability. Canon Medical's remote diagnostic services Direct Connect personalised service and extensive inventory of spare parts located across Australia and New Zealand allows us to maximise your equipment uptime. We plan ahead to ensure we can act quickly and responsibly and deliver reliable care. Many vendors speak about 9 to 5 uptime credits when they don't achieve uptime targets and call centres. Canon's focus is on 24/7 system availability, so you can provide services whenever they are needed.
Canon offers Innovision remote service support for all CT, angio and MRI systems. Innovision allows us to perform proactive service. Automated predictive diagnostics alert our engineering team of potential issues before they become a problem for you. If a system fault does occur, our engineers can use Innovision to diagnose the issue remotely. This reduces the time to identify possible causes, suggest countermeasures and allows our most experienced engineers to assist from anywhere across Australia and New Zealand. Prompt and proactive identification of faults also means that the first engineer attending your site can bring a suitable spare parts from local inventory. At Canon Medical, we pride ourselves on our extensive inventory of local spare parts. We stock critical spare parts including tubes, detectors and transducers across Australia and New Zealand to maximise system availability. Consider this scenario. Your CT tube fails 5 p.m. on Monday. What happens when a company stores tubes in Singapore? After the engineer's visit, diagnosis, ordering, overnight shipping, customs clearance, delivery, install, alignment, calibration, etc., your system should be ready Wednesday around 5 p.m. So that's a full 2 days of downtime, from 5 p.m. Monday to 5 p.m. Wednesday. What does this extra downtime cost you? 2 days, 30 patients a day, let's say $250 each, equates to $15,000 in lost revenue. Not to mention lost revenue from referrers and patient dissatisfaction, and impacted patient outcomes. With Canon, faults can be proactively identified and diagnosed via Innovision and a part positioned before the engineer's visit. A tube is delivered from our local warehouse and then changed, aligned and the system calibrated overnight so that it's operational and ready for patients Tuesday morning. Extra downtime affects your reputation. Our spare parts inventory improves your uptime and minimises the impact that equipment faults have on your patients, referrers, staff and business.
When our systems are PRP, a spare part from Canon, we experience particularly good service. It's been quite rare for us to find that a spare part needs to be shipped in from overseas and that we're waiting a day or two for it. It's become obvious that Canon store quite a lot of the spare parts locally, and it's of great benefit to our business because any downtime is negative for our patients and referrers.
One of the benefits of working with Canon Medical and having associations with their products is the ability to have access to spare parts. I think it's so important. Having spare parts in the country and ease of access is really important to us in ensuring that we can continue to provide continuity of service. No one knows when a breakdown is going to occur, but when it does, it's comforting for us to know that we can call on the phone, talk to an engineer and have an expectation that parts will be there before it becomes too much of an issue from a service perspective.
Who loves using call centres? Nobody, especially when you're trying to manage a patient work list and an equipment fault. With Canon's Direct Connect service, you have direct access to your designated engineer's mobile phone. Speak directly to someone you know and someone who knows your equipment, site, staff and doctors. Why explain your request repeatedly as you are transferred from a call centre to some form of triage and then to an unknown engineer? Direct Connect saves you and your staff time and stress and ensures that your system is up and running sooner. This helps provide better outcomes for operators, patients and your business's reputation. A true Canon unique to help improve your uptime.
So having immediate access to an engineer who understands the system intimately, right down to the nuts and bolts, and immediate access, gives me a better opportunity to discuss with the physician and the patient how and when we can be back up and running. That's a very limited breakdown time. If I have to phone Singapore then have to phone their engineer phones me. I've got a 2-hour turnaround time before I get any decisions.
Having direct access to the engineers is incredibly important to us on two fronts really. It improves the response time generally. The engineer has a more intimate knowledge of that system and works well with the teams on the ground to find a solution, sometimes without even heading to site, but it does improve, we've found, our uptime. And also too, it strengthens the relationship between those on the ground on our side and the engineers, which at different times when challenges present has proved invaluable.
I've always been impressed by Canon's rapid response times. In a busy cardiac cath lab, it is important that any downtime is kept to a minimum. If we experience an issue with our system, we need to get an accurate indication of what it is and when it can be fixed. With Canon's Direct Connect service option, I can ring the engineers directly and explain the issue over the phone.